Welcome to week 3. This is your news video for week 3. So now that drop an ad is over, it closed out last Wednesday, we now have our class, and there were a few students that were still trying to jiggle their schedule around and trying to kind of figure out where they needed to go. Some students are still working on getting their textbook, but hopefully now you either have the ebook or you have the textbook and you can start working on your readings. So I have posted a few videos, so go back and look at the videos and just to kind of familiarize yourself with the first few chapters. So the first discussion question asked you about defining abnormality, and I've gone through the discussion questions. I'm going to upload a response kind of to the class. And what I did was just basically a quick visual content analysis. So in psychology, we do a lot of content analysis. Anytime we do surveys, interviews, or case studies, we kind of isolate our constructs or our variables. We kind of put that into the computer program, and we kind of see what's being stated the most. And what I noticed from your discussion responses on abnormality, a lot of you use the word norm, like normal. And that's important because you have to think about it, even if it was like a Likert scale, like if you had a situation on a scale, how would you rate that normal to abnormal? And I think that's what we do. I think in our social context, in our social environment, what we are exposed to, in our mind we kind of use that 1 to 5 gauge as to what we feel is normal and abnormal. But many of you responded against norms, and another word, society. I noticed that kept pinging up on your discussion responses as well. So a lot of you are away from the norm. A lot of you said deviation from society, what society says is different. You looked at abnormality as a behavior that people might display. So those are the words that I kind of noticed as I was going through your definition. For us in the world of clinical psychology, abnormal psychology, we have to have some definition of abnormality. So even though I kind of opened it up as a broad response on the definition of abnormality, there's certain elements of abnormality that we look for when we are putting together criteria and symptomology of specific mental illnesses. So keep this in mind too. In fact, jot it down if you want to. First of all, think about discomfort, subjective discomfort. I think all of us would agree that you could be sitting next to somebody who may be experiencing real subjective discomfort, and you may not. You may think, what's wrong with the situation? So you never really know if someone, how they feel is more subjective. A word, keep in mind too, is maladaptive. Most of us have adaptive skills or coping skills that we have learned throughout our life, to where when situations come up, we kind of pull out those coping skills and we kind of use them to kind of deal with our situation. I asked this in class. I said, what do you do to kind of cope? People said they take a walk, or they listen to music, or they read a book. There's adaptive skills that we use to kind of deal with situations. But if people run out of those coping skills and they can't deal with it, they may develop maladaptive coping skills. An example would be drinking. When you think about individuals who are drinking, by themselves, or in situations that you wouldn't see that would be normal social situations, you think about maybe that's their coping skill. That's kind of how they deal with it. So keep maladaptive in mind. Also, social deviance. Are people displaying behavior that's kind of deviating? Because you mentioned society, deviating away from what our norms as society. Is it deviancy in some point, and how they deal with that? Also too, irrationality. Some people, and you know this, you may have friends where they're talking and you're like, what are you saying? That's crazy. A formal word would be more that they're becoming irrational. The way that they're thinking, the way they're dealing with the situation. Unpredictability. Are individuals coming to the point in the mental illness where now their behavior, their thoughts are becoming unpredictable? So when you think about some of the elements of abnormality, think about social discomfort, subjective discomfort, maladaptive behavior, social deviancy, standards of society, because you brought that up in your definition, irrationality and unpredictability. Write those words down. And as we go through each of the disorders and you look at the criteria, because I'm going to talk about that criteria for you, as I progress in the videos, are they meeting those elements not just a definition, but the elements of abnormality. So what I want you to focus on this week is chapter 2 and chapter 3. And chapter 2 talks a little bit about the process of how we go about looking at treatment, client versus patient, how we identify ourselves as professionals. So just key in on those words. And the big factor is the DSM, the Diagnostical and Statistical Manual of Mental Illnesses. Now, I don't require you to purchase that, but for those of you who are going to go into counseling, social work, it's kind of what we use. That's what we base the entire class on, is the DSM. So as we progress through the different disorders, because the chapters don't specifically say what the symptomology, I'm going to present those to you. I'm going to tell you each disorder and the symptoms and the criteria for diagnosing. So going into a little bit of chapter 2. Chapter 3 gets into a little bit of the assessment. It's one thing to learn all the different symptoms and all the criteria and all the disorders, but to sit down with somebody and actually do an assessment, to ask them those questions, to formulate a clinical picture, that's where practice comes in. So just take a look at those readings. Now you're getting your feet wet. You're getting into the process of how we actually go about what that definition. How do we actually kind of define it based on our diagnosing, our treatment, our diagnostical book, the DSM, and how we go about formulating an assessment. So start in on your readings this week as we progress. Next week you'll have your first case study, your first patient. So if you can get that reading behind you, remember those elements of abnormality that I talked about, that's going to be a good foundation. Okay? Enjoy the readings. Bye.